So now the last question we have when we're figuring our treatment is how many treatments do we do of this? So with ultrasound, the biggest question is it working? So are we continuing to see progress? If we're not seeing improvement after about 4 to 5 treatments, we need to discontinue or we need to change our parameters and try to target things differently because that's a sign that this isn't responding to the ultrasound. So we have all these other types of treatments at our disposal. Don't stick with something just because you think it should work if it's not working. In general, for acute conditions, they usually require more treatments over a shorter period of time. So you can usually do treatments twice a day and do it for about 6 to 8 days, so about a week long. And we should see kind of all the benefits that we're going to get out of those acute. So again, that's the non-thermal type situations. With more chronic conditions, we require fewer treatments over a longer period of time and kind of alternating days. So usually looking about 10 to 12 days where we do a treatment every other day. We can go longer than that, but again, if we're getting into about 12 to 15 treatments, ideally the number we hear a lot of times is 14, then we really have to start thinking like, are we getting the results that we want? More than that means that it's probably not working anymore. We've probably either plateaued if we were having results, we've probably plateaued. We should probably stop and try something else. That's not to say we won't go back to ultrasound maybe at some point, but for a while we need to see if there's something else that will make more progress. And that's really with any treatment, right? Like if we're not continuing to make steps forward, we should, after 4 or 5 days, in this case, up to maybe 14 treatments, then we really want to reevaluate and say, is this working? Is this working for this patient? What else can we try, right? Back to that evidence-based decision-making tree. So if we take this option out, what else is there? What else is available?